In today's Health Matters, defining quality LGBTQ plus healthcare, what it looks like, and more importantly, what are the outcomes?
As we celebrate Pride Month, we want to address the healthcare disparities facing LGBTQ plus individuals in access, treatment, and support. Samantha Quigneaux is on the front lines of this fight as the National Director of Family Therapy Services for Newport Health, and she is joining us this morning to discuss how these disparities are being addressed. So good morning to you, Samantha. Thanks for being with us.
Good morning. I'm so happy to be here.
So can we talk about this, creating, affirming, and specialized care for LGBTQ plus individuals? It requires more than just tolerance, right? I mean, so what are the steps that healthcare providers have to take to create a safe environment from the moment that patients walk through the door?
It's just that we have to move past a place of tolerance into active affirmation, making sure that we can significantly improve that feeling of being seen for our alliance, for the client engagement, for our patient engagement. We're also adding that affirmation by updating intake forms, offering gender-neutral facilities, and offering ongoing training and support for our staff to prevent discrimination and to ensure that all of the patients we're seeing have equitable treatment for the patients and that they're being seen and feeling really valued.
Right, an important component here. There's a level of cultural competence that also informs how healthcare providers interact with LGBTQ plus patients. What does that include?
So it absolutely involves actively validating, respecting, and supporting how an individual defines themselves. We have to use their chosen names, have to check in about their pronouns consistently, and avoid making any assumptions about gender, about sexuality, about relationships, or about family structures. That we have to include often assessments about their sexual orientation and gender identity. So we're always checking in and asking those questions to be a part of that conversation with the patients.
Yeah, so once a patient gets into the office, in doctor's office, what are the specific medical screenings and the conversations that healthcare providers should be having with LGBTQ plus patients?
In addition, of course, to the routine physicals, then preventative screenings, we also want to be really conscientious of cancer screenings. And for those that are receiving any type of hormone therapy, that we are checking their blood levels and their liver functioning and blood counts, that we are providing sexual screenings and health and safety, any HIV testing or PrEP, any types of vaccinations, and really making sure that we're engaging on their overall mental and physical health at that meeting.
Yeah, let's talk about mental health, because LGBTQ plus individuals are nearly twice as likely to experience mental health conditions. What kind of training is there for healthcare providers to really detect when there's a problem?
There are so many wonderful trainings that are available that are specifically related to LGBTQ plus cultural humility and competency for providers to understand the evolving terminology, to understand health disparities and the impact of discrimination and the impact on patients of minority stress. There are, of course, a number of evidence-based tools that we have to screen depression and anxiety, suicide risks, substance use, and even trauma. Ultimately, I would say for healthcare providers, we have to build that trust, safety, and collaboration so that we can have these types of conversations and offer really forward-thinking medical care.
Yeah, but it really goes beyond the medical providers, doesn't it, when it comes to overall health and wellness for LGBTQ plus patients? So who else should be involved?
You mentioned before mental health, and being LGBTQ plus does not inherently increase your risk of being feeling anxious or depressed. It's the response to the lived experience of identifying as LGBTQ plus. So for positive relationships, for community, for family members, for cousins and friends, and finding that community. That's why Pride Month is so critical. It's building this sense of community to make sure that everybody's feeling seen and valued as they are who they are.
Right. Samantha, any quick resources you'd like to share that folks can perhaps discover online?
The Trevor Project is a really wonderful resource that offers many different values for the LGBTQ plus community and anyone who's wanting to look into it.
Yeah, it certainly takes a village. Samantha, thank you so much for your time this morning. We appreciate it. And happy Pride Month to you.
Likewise.